Welcome, everyone. It is our second COVID conversation. We're glad that you joined us, and on fairly short notice, I hope that if you did lose power, that you've got it back, and that your loved ones are safe and warm. It's been a pretty challenging week for a couple weeks for many. It reminded me a little bit of what some people faced with the wildfires, where you don't really want to go to a warming shelter, maybe because of COVID, and that's a whole nother conversation. So I want to welcome you. If you're just joining, I'm seeing everyone is doing a lovely job of turning your videos off, unless you're a speaker. I appreciate that. No doorbells this time, and we are recording this. And this time it'll be in a slightly better viewing presentation mode. So I appreciate your flexibility. So this is our second COVID conversation, bringing it all together. Just a reminder, it's sponsored by the Oregon Institute of Occupational Health Sciences and the Oregon Healthy Workforce Center, with support from a number of professional associations that you are all members of. The Oregon State Association of Occupational Health Nurses, the Columbia Willamette chapter and other chapters of ASSP, and the Pacific Northwest American Industrial Hygiene Portland Education section. Phew, that's a lot of long words. We're going to continue with this series as long as it feels relevant. So we are targeting, again, the second and fourth Tuesdays of the month with this short. Hopefully you can fit it in your schedule. It will be recorded, and as you hopefully found, it goes on our Oregon Healthy Workforce Center YouTube page. I'll always do a follow-up blog, so you can see that. And I think that's probably all I really need to say, other than we're going to rotate every 2 weeks. We're trying to, where it's an occupational health nurse or practitioner provider, and then it's a safety and health professional. So today, I'm quite excited to welcome the wonderful Kim Henry. Kim is an industrial hygienist with SAIF. And so my first question, and keep this one kind of brief, Kim, but we'd love to hear, how are you involved in COVID-19, is related to your current job?
Yeah, so being an industrial hygienist, definitely we are, like a lot of folks, trying to figure out how to serve our customers still, right, and our clients. So we're doing field visits, kind of. We've got a process in place to do that safely. And also keeping up with the regulation, the Oregon OSHA regulation, all the way through that. We've provided, my partner Liz Hill and I have provided some webinars and some tools. I also am part of a COVID crew. That's what we call ourselves at SAIF, and we meet every other week, kind of keep on top of any changes, the vaccine, things like that. So pretty heavily involved with this particular topic in my job right now. Yeah. Is that brief enough?
Yes,
I could go on, and I don't think we need to.
No, that's great. I was just unmuting myself. Sorry. So I was really interested to hear about this task force. I think you called it a task force that you're involved in with the American Conference of Governmental Industrial Hygienists.
Oh, you said it good. Thank you for saying it.
Yeah, if you're an industrial hygienist, you have to learn that one. Or ACGIH. Mm-hmm. And, I just tell us a little bit about that, and, timeline goals, whatever you think is most useful for us to know about what your kind of that group's intentions are.
Yeah, sure. So this was a call out for volunteers at the beginning of this year for ACGIH, and they call it the Pandemic Task Force. And there's 3 groups that they've identified, all volunteers, and one is a group for ventilation, another is a group for face coverings, and another is a group for programs. And I'm on the group for programs, and our goal is to basically create a kind of an easy go-to for, or guide, if you will, for safety and health professionals, or those that are tasked with safety and health out there in the field. As we know, some folks get tasked with that responsibility that aren't necessarily, that's their career, right? So pulling together all kinds of programmatic information on how to handle COVID in the workplace, and linking to resources that are credible. And that's what we're looking at right now. So we're in the midst of reviewing all of the emergency standards that there's 4 states in the union that have created those, right? Oregon being one of them, California, Michigan, and Virginia. And Virginia just made theirs permanent. So they went from a emergency temporary standard to a permanent standard. They're the first to do that, and we're on the trajectory to do that here in Oregon too. But what we're doing right now with the task force is reviewing all of those regulations, and we are also paying attention to federal OSHA and their work and what they're moving towards. And we're going to call all of that because there's common elements in all of those regulations to deal with COVID-19 in the workplace. So we're looking at that, similarities, differences, and then we're going to pull together a resource and publish that through ACGIH. Yeah, so good stuff. Lots of good people working on it. And that's one of the things I've noticed through this whole thing, because of my position helping with the COVID crew and, questions and answers about this topic since the pandemic started. There are so many people working on this, so many scientists, so many occupational health folks, so many, obviously we know nurses and doctors and everything, but there's so many others working on this and working collaboratively in ways they haven't before. There's the open forum for, things aren't getting peer reviewed because things are changing so fast, but there's open access online that you can read about what everybody's doing. So it's been fascinating to me personally to see how much information is being shared and what we're doing out there and working together to conquer this thing.
Yeah, I think that's a great point. And I have a question. Before I do, I would just remind everybody, feel free to put any questions you have in the chat. And as we get to about 20 after, Nicole's going to pipe up with sharing those questions for all of us. But what you said, Kim, makes me think about that. Well, that's awesome. We're all working together. It's just almost like an overload, right?
Yeah.
And there have been some great efforts, I know, with the National Safety Council and AIHA coming together and ASSP on some things. And I don't really have a question on that, but it is concerning in the sense it is hard to stay up. And certainly that's part of what we're trying to do here is at least bring out things that are useful for those of us in the Pacific Northwest. I don't know if you have any thoughts on that.
I think, and this kind of came out of just dealing with questions and answers from policyholders, for instance, and then also reviewing the different standards for the different states. And the one thing, and this may not be that helpful, but it did help me to kind of just get grounded, stay grounded and centered on this, is there's a lot of what we already do and what we already know that is so applicable. And if we can just kind of use what we do best already, which is evaluate for exposure risks and then figure out what kind of controls work. We just need to really know what the hazard is that we're dealing with, right? We need to get more information on that. Now, at the beginning of the pandemic, we didn't really fully have that. We definitely have a better idea now. What's helped me is, and Lisa Brousseau talks about this, but and it's different. Infectious disease is more typically a public health issue, right? Now we're talking the occupational health world, which, as you know, with total worker health, there's not really, it's an illusion for that to be divided to a degree, but thinking of it as source pathway. And the source in this case has been us, right? And then the pathway is how it gets from us to others. And we know so we know what the hazard is. We know now a lot more about how it's transmitted, so we can do those controls. So it's been helpful to kind of just reground around using what we already know and implementing that. The other thing is how important mental health is and support for each other. really learning about that and talking with employers to make sure that they're communicating if they've got an EAP, making that available for folks and just checking in with each other. That's been most helpful, I think, through this whole thing.
Yeah, I appreciate you bringing up the connection with total worker health. As you know, I think any of us who have been working on that kind of initiative with those concepts, it's been so clear. This is probably the best example, and I think we talked about that in our last session. I think it also really brings up, the communication piece. I don't know if any of you caught the little article in the New York Times the other day that was kind of criticizing how careful we are to share 100% proven science to the population, to the public, because then they think, and the example was given with vaccines, well, if you're going to get a vaccine and you still have to wear a mask and you still have to be careful, kind of why bother? And I think that this is a continual, sorry, I just got a little pop-up. I don't want to shut my computer down.
So did I.
I think this is a continual reminder about how best to communicate. And we're not doing it perfectly, and we probably never will, but it's great lessons. Kim, I want to go back to one thing you talked about. I'm really curious. I think some of us are curious. As you compare the state standards, right? Are you seeing some things or some things jumping out? I've started looking at Virginia when it came out, and certainly I know Oregon OSHA, but I know you're not there yet and really fully evaluating them, but is there anything that's jumping out that's a kind of a lesson for those of us in Oregon?
As far as the lesson goes, I have to say the one thing that's jumped out is how well Oregon's done, frankly. And so I kept on top of that standard as it was being, worked through and then implemented. But really, I think Oregon's done a really good job. So there's that. There's a lot of commonalities across the board, and that's everything from face coverings, physical distancing, ventilation, increasing outdoor air, fresh air, looking at your workplace design. Remote work is mentioned across the board. Being flexible, maybe with sick time or personal time off, that kind of thing. So there's a lot of commonalities, which is good, right? There are some differences. California has some. They already had an aerosol transmission standard, but now they've created some COVID-19 specific rules around workplaces. They actually require, for instance, COVID-19 testing for all employees who had a potential exposure in the workplace. So that's on the employer to make that happen at no cost during work hours, that kind of thing. So that's a little bit different. Not saying one way or another, but where if that needs to be in the mix. Let's see, Virginia requires pre-screening of all employees before they come into the workplace, and there's a process, so they call that out. That's a little bit different. Also, one of the things that I guess I like about Virginia is they really talk about with the element of flexible work shifts and sick leave and so on. They really, have verbiage in there about mental health support, things like that, and really supporting workers, not just in preventing COVID-19, but dealing with the impacts that we're all dealing with, right? So support of workers in ways that maybe some of the other rules don't necessarily call out. But there's, for the most part, a lot of commonalities. Yeah. So if you're getting used to Oregon OSHA's standard, you're in good shape.
Right. We'll see if there's a federal standard that comes out, right?
March 15th, I think we'll know one way or another, right?
Yeah, that, I'm sure our friends at Oregon OSHA are kind of like, oh, here we go, right? To make sure that our standard is at least as protective.
I think it will be, actually. Yeah.
Terrific. That's really helpful. And I think a little bit related to that, which is some newer news, it may not be new for some people, but now with the vaccines slowly being implemented, the guidance that I'm hearing certainly is that once you've had both vaccines and several weeks have passed, if you have a exposure, so we think about this in the workplace, if you have a potential exposure, you are not quarantined. Or you don't,
According to CDC,
according to
that's,
CDC and the
yep.
various healthcare organizations are following along with that with their own employees. So, I mean, that's kind of interesting. Yeah.
Yeah, it is because there's, and I know there's a little bit of trepidation on folks' parts because there's the variants that we're talking about and the efficacy of the current vaccines with those. And I just want to throw in, I think that's really why it's important that we continue the practicing. And I know that this is going to be, at the forefront for quite a while for the foreseeable future as we continue distancing and face coverings and so forth, even after you have your both doses. We've got a ways to go.
Yeah, and I think that's the hard one to share with the public at large, especially
Yeah,
as there's fatigue with all of it. Yeah, thanks.
absolutely.
Well, Kim, is there anything else you kind of wanted to share with us today that's relevant to the conversation?
Um, no, I think, the big thing that I would just say is just hang in there. And I know that's, everybody's probably saying that to each other, but it's helped me so much being a part of those that are working on it and implementing it in the workplaces and just really being there for people, especially employers. I mean, we're definitely there to protect workers, but helping the employers figure out how to do this and how to do it safely, and coming up with ideas if we've got ideas, or pointing them in the, where there's resources to use. So that's been helpful. I have a question. Can I ask you a question?
Sure.
Is that okay in an interview? And turn it on the interviewer. I was just curious about the, I hear this NIOSH IPA that and I say IPA and I think of, well,
No.
I won't say what, anyway, I was curious about it and I just wondered if you might share a little bit about that.
Yeah, some of you know I have a very small percent of my time paid for by NIOSH as this IPA. Some of you have maybe heard this before. It's a way that NIOSH can put money towards work through other public agency staff. So an interpersonnel agency agreement. And when COVID hit, they really recognized there's not enough NIOSH staff to do what needs to be done, and especially throughout the United States. And so they put together a team of I think there's about 43 of us, mostly affiliated with universities throughout the United States. And they kind of asked different people to apply and different technical expertise. And so I do have that within the Pacific Northwest. Some of you know Marissa Baker at University of Washington. She holds one. And there's two folks with Oregon State affiliated with the Sea Grants who are doing fisheries work around COVID-19. It's all specific to COVID-19. So the whole point is, how do we safely get workers not just back to work, but at work? And how do we share our information? And I think it's kind of like a couple of things. I think the greatest gain for me on that is hearing what's going on everywhere else and being able to share that with all of you, which I try to do through the blog and through our connections here. And I'll continue to do that more. I'll probably blog next week on some of the newest releases. For example, they're going to be coming out this week with some guidance for ventilation standards for schools that I believe will be more specific than what we've seen in the past, but we'll see. That's just one little example. Both Marissa and the other IPAs in Oregon have really been working, as I said, with the fisheries and, looking at support, everything from CARES, making sure people know how to access that, to a lot on mental health. Lots and lots of, what is going on. Marissa told me she's never had as much feedback back up from a survey as she's getting from the fisheries folks on the support they need, the support they have, and what they're struggling with. Within my own piece, I've been working a little bit, as some of you know, with the Oregon COVID Construction Task Force and doing a survey around how do we get information out within our state, as well as little bits with different industries, ag and others. So if anyone's interested in that, please reach out to me and we'll try to kind of get more information. I think it's fantastic.
Awesome.
We have these monthly meetings. We had one yesterday, a couple times a month, and what people are doing and the different think about the knowledge that we have not just at NIOSH, but people in universities on things like infection control and ventilation and, really top specialist information and trying to share that. So
Good
yeah,
stuff.
thanks for asking. I think on that note, we are at our 20 after. I'm hoping we have some questions out there. And Nicole, I haven't been able to look at the chat. How are we doing? Any questions?
We do. We have a couple of good ones. Kim, thank you so much for all the great information. Just ask you to expand a little bit. Kate Wood has a great question about how are you applying the total worker health or the safety, NIOSH safety hierarchy of controls to the COVID situation. And when you're sort of advising and guiding employers, how do you help them prioritize, particularly with limited resources around Oregon?
Yeah, so as far as, and I think Dede kind of stated it too, it is a total worker health framework. It's how I look at things anyway. So I don't necessarily say to an employer, you're doing total worker health, or this would be more total worker health, for instance. We just talk about the topic or the issue, the need that they have, and it happens to fit in that framework, if that makes sense. So, for instance, we might talk about, I was at a policyholder in Bend at the end of last year, and they have a pre-screening protocol that they're doing with their employees. And one of the things we talked about is, and it was wonderful, it wasn't even my suggestion, he just shared it with me, that he takes that opportunity every morning to check in with his employees, just to see how they're feeling, see how they're doing, not just do the screening questions, for instance. And that has actually allowed him to know his employees better, and even know, and he's actually had a couple of instances where he said, you know what, they were just stressed out. They were really, they weren't sick, but they were really stressed out and having a hard day. And he actually told them to go home and, take a day. And so that was really cool to hear that. And I know that those are the kind of conversations I'm having out there. So there's that. And then with regard to the hierarchy, that's an interesting question, because as an industrial hygienist, and I know a lot of folks, we try to fit everything into the hierarchy of controls. And, there was a lot of, at the beginning, well, no, that's not an engineering control, that's an admin control. No, that's PPE, what's a face covering, that kind of thing. And it tripped us up a little bit. And that's why I brought up the source, pathway, and receiver kind of trajectory there. And we just have to interrupt. That's how I've been looking at it, is there's the source, which is potentially all of us with the asymptomatic spread. We just don't know, who might have it. So that's a challenge. That's part of why this is so crazy right now. And then there's the pathway. And, that's the environmental controls and things like that. So that's kind of how I've been looking at it.
So with these risks that seem to be fairly ubiquitous, given the nature of COVID and how it's transmitted, it sounds like you're also finding that employers are using this opportunity to kind of lean in and remind themselves and explore the concepts of supervisor support and how that can really have a real impact on people's physical and mental safety and health.
Absolutely. Yeah, it's a great opportunity, and I'm seeing it. I'm seeing people take that opportunity out there.
Oh, wonderful. Well, we love to hear that, don't we? Another piece, and I think this is a great question that really shows how complex this is. So this one is, I'm just going to read it out loud because we've discussed already that air monitoring can be a struggle. And so Rob Dahl's question is, can I engage SAIF to help evaluate those spaces, even if we don't own the space or control the HVAC?
So as far as engaging SAIF to evaluate, I think the big thing that we would be helpful in is helping look at workplace design. We could definitely do that and walk through, what does the space look like? What options do you have as far as all of the things, the layered approach that we know, right?
Mm-hmm.
So, having how many entries and exits to the space do you have? Is it an open floor plan? What are the options that you have? And as far as there are requirements for building operators. So even though the employer doesn't own the space, there's requirements on building operators also to operate the ventilation system a certain way. So that would be one thing too, is talking to the building operator and making sure that they're following the requirements. So SAIF could help partner in that for sure. Definitely.
That's great. Thank you so much. And as a reminder to our audience, SAIF is the state-funded accident and insurance fund. And so you'll find a lot of publicly available information on SAIF's website. Even if you're not a policy holder, it is absolutely rich with resources. I encourage everybody to go ahead and take a visit.
Yeah, thanks, Nicole, for mentioning that. We do have a coronavirus resource page, and everybody can access that. So
wonderful. Thank you so much. I think we want to just sort of close with bringing this all together. One theme that Kate Wood has pointed out, and I think we're all noticing in this conversation today, is the value of the trusted messenger. As we are, SAIF is a trusted messenger, and you're also helping, organizations identify who their trusted messengers are. As we are working through this hierarchy of controls, in some cases, we do find ourselves working several layers at the same time, don't we? And the piece that brings all of that together is the trusted messenger. When we are able to communicate well, and feel the support from our supervisors all the way throughout the organization. And I just thank you for really bringing that to our attention.
Yeah, that's a great point, Nicole. Thank you for that. And different messengers, right? We've seen that a lot.
Yes.
My trusted messenger may not be yours. Yeah.
And I would say too, is it's okay to say, I don't know. And I'm going to look for that information and try to help you. And that's so important. We can't know everything right now. Even the best experts don't know everything right now. So
I think that's such an important point. And for newer and younger safety and health professionals, I think that's the best thing I ever learned that really reduced my own stress level, because we can't be experts at everything. And once you feel like you have to be, that's, well, you're not. And so
right.
You may err on the wrong side, but that's great. Thanks for sharing that. So I think that is concluding our time today. But before you go, thank you for joining. We will probably do one more very short evaluation that you'll get by email later today or tomorrow from me. It's helpful for us. And in there, if you have suggestions of something different for us to address, that's really helpful. We're kind of rolling with this. And our next one will be, I'm looking at my calendar here. It looks like it's Tuesday, March 9th. I'm looking for someone to agree with me on that. Yeah, I think that's correct, at 9 o'clock. And we'll let you know what that is. And thank you all. Have a great day and stay safe and continue to follow our information. We very much appreciate your support.
Thanks, everybody.
Thank you.